Yeah, and I think it's just training your eyes, just like, and the great thing is training your eyes to see posture and training your hands to palpate and to differentiate postural deviations is much easier than pulse diagnosis.
I'm Michael Max, and this is Qiological. We all have a creation story. Patients have one about their illness, and we have one about why we do what we do and why it matters. Creation stories help to answer the question, why is life like this right now? And they set the foreshadowing of what might happen later at the end of our days. All mythology has a creation story. It's the bones of any belief system, a touchstone for how to make sense of how our experience unfolds in this world. Creation stories are the whisper behind the whisper, the thoughts that tell us who we are, why we are a certain way. These stories frame how and where our perception shines its focus, allows in or rules out the live stream of the world. These stories are cultural. They give identity. They let us know what tribe we belong to and which ones we don't. And regardless of whether we are dividing light from dark, exploding from nothingness to somethingness, the children of a celestial being, and whether we're created or part of the creative process itself, there is this curious human urge to make sense of the present by framing it in a particular moment of becoming from the past. Creation stories are a part of our clinical encounters. Patients have a story about their illness. They are as much looking for confirmation of their story as they are a fresh perspective on something that's been troubling enough to have them make an appointment to come see you for the problem they have. The limits of what's possible or not can be rooted in a family story of how things are, or a belief that limits how the world works. I don't know about you, but I've found that in my clinical work, patients sometimes come in arguing for why they can't change something in their life. Something that clearly is bringing on the headaches, relationship troubles, weight gain, or disturbed sleep. Especially when I hear how they make a badge of honor about something that's causing them deep suffering, I wonder about the creation story behind this behavior and how it served them well in one particular moment, but is the source of incredible suffering for so many other moments of life. Sometimes the root of a problem is the reference story that we go back to. Enlarge the frame on that story, or notice how the younger self only saw a snapshot of what was a much larger movie, and the experience and perception of this moment that can also change. In a moment, we're going to get into a conversation about posture, body mechanics, how the musculoskeletal system works, and use of the knife needle. These conversations come to you through the generous support of our sponsors and members. Blue Poppy, your new one-stop shop, has speedy shipping options on everything that you need for your clinic. It's Women's Health Month at Mayway Herbs. Check out the new website for learning resources on helping women with herbal medicine. Are you a creature of habit? How about making a change that helps your patients and the planet with AccuFast needles? And later in the show, raising your fees doesn't have to be a difficult process. Jane has helpful suggestions on making it easy and effective. And finally, have you considered that having a thriving, profitable practice is one of the most healing things that you can do? Julie Bear Don't Walk has, and she can help you do something about it too. Do be sure to visit the sponsors page on the Qiological website to take advantage of all the special offers our terrific sponsors have for listeners of the podcast. Picture this. Your clinic is buzzing with patients, and then you realize that you're down to your last box of needles. No need for panic, because Blue Poppy, your one-stop shop for all your acupuncture needs, they ship orders received before 3 p.m. on the same day. With a quick visit to Blue Poppy's website, you can order premium needles, herbal formulas, and that special Dr. Bob's oil that your patients love. Blue Poppy understands practitioners can't keep patients waiting. That's why they strive to get you what you need when you need it. From high-quality Chinese herbs and formulations to acupuncture supplies and clinical essentials, Blue Poppy has served practitioners for nearly 40 years with products that meet the highest of standards. Discover everything Blue Poppy has to offer by visiting www.bluepoppy.com, and don't forget to subscribe to their mailing list for exclusive offers and more.
Hi folks, I'm Yvonne Lau, president of Mayway Herbs. May is Women's Health Month, and as a women-owned and women-run business, we especially love how Chinese medicine can support wellness through every stage of a woman's life. So in this month's newsletter and podcast, we're covering topics like PMS, pregnancy, menopause, and osteoporosis. We'll share expert insights and effective treatment strategies you can put to good use in your clinic. Our Plumflower brand line includes herbal tea pills, tablets, extract granules, and organic herbs, all of which you can find on Mayway.com, and where you can also find articles, videos, and other resources to support your practice. Since 1969, Mayway has been a trusted source for high-quality herbal products. In these challenging times, please know that we remain committed to keeping our products accessible and affordable so you can take care of yourself and your patients. As always, thank you for supporting Real Chinese Medicine.
Daily habits and routines feel comforting, familiar, easy, automatic. That's the power of repetition. You've worked out the kinks and can do it with your eyes closed. But what if you shook things up? What if you ditched the old routine and tried something new? Hi, I'm John Sten. I've practiced acupuncture for over 30 years, and together with my wife Kelly, we created the world's first eco-friendly acupuncture needle. The AcuFast earth-friendly needle system cuts your packaging waste by 60 to 90%, depending upon your needle type, speeds up your needling, gives you more control, and best of all, while you're healing patients, we plant a tree for every 2 boxes your clinic uses. Thousands of acupuncturists have already made the switch. In just the last year, they've helped plant over 16,000 trees. Since we started, that number has grown to over 50,000. So break the routine. Be the change. Visit acufastneedles.com. Your patients and the planet will thank you.
Brian Bowen, welcome to Geological.
Hey, thanks, Michael. Thanks for having me on. I appreciate it.
Yeah, it's always fun to talk about different aspects of Chinese medicine that I don't know jack about.
Uh-huh.
I'd like to know what got you into acupuncture in the first place. I mean, I think we are of an age, we're not told in high school, hey, kid, go check out acupuncture as a career.
Mine's not like this amazing heroic story where some people got in traumatic car accidents or fell off a horse and got healed themselves by acupuncture. But it's definitely kind of a fun one. I grew up in Missouri, and so it was you're in St. Louis, so right in the neck of your word. So back in the day, in '92, I'd never heard of acupuncture. Being in the Midwest, I was itching to get out of Missouri, so I moved to California to go to school. And when I moved there, I met some different friends, and I had this one friend of mine who was getting ready to have a knee surgery, and his mom was into more natural holistic medicine, and so she made him go have some acupuncture first. And so he did 3 sessions of acupuncture and totally avoided the knee surgery. So I was mesmerized. Once you have awareness of something, you start seeing it more and more. So I started seeing TV commercials about acupuncture. And so I decided that I was going to be an acupuncturist. So why not just call an acupuncture supply company and ask them to purchase some needles? So I was 18 and called an
18 years old.
Yeah. So I was 18 and I called an acupuncture supply company. And I'm like, I need to purchase some acupuncture needles. And they're like, all right, what size are you looking for? I'm like, what sizes do you have? I have no idea what I'm talking about. So
at the age of 18, you can totally do this and not be self-conscious.
Oh, absolutely. Yeah, I was all in. And I had no idea what I was doing, but I was all in for sure. So they're like, well, wait a second. Are you an acupuncturist? I'm like, no. They're like, were you an acupuncture student? No. Well, you can't buy acupuncture needles. I'm like, well, okay. Well, what do you got to do to make that happen? And so they're like, well, you have to go to school for that. So anyway, I was spinning my wheels, taking classes that I just didn't feel like I was on my right path. And that always stuck in my mind. And so I moved back to Missouri for a bit and started a catering company. So I have a passion for food, and just had a bad business partner and was kind of spinning my wheels there, thinking about what's next. My girlfriend's girlfriend was leaving town, so she was really upset. And I'm like, well, what is she doing? Where's she going? And she's like, well, she's going to massage school. That hit me since I was always working on people. So I was driving around town one day trying to figure out, where am I going to go? What's going to happen? And so James Taylor came on the radio and started singing Going to Carolina in my mind.
Oh,
And so I
no.
took that as an omen. And, you got to listen to him. Took it as an omen, went and bought a massage journal magazine. And in the back, there was a list of approved massage schools. And there was one in North Carolina at the time. And so I went and checked it out, and like, it was all the perfect fit. It was like, the universe was definitely talking to me. And so during my studies there, one of my anatomy instructors that was there was an acupuncturist. So he kind of reintroduced me to it, gave me some needles, gave me a couple books, and I started poking away on myself. Then I went to acupuncture school. So again, not a glorious story as far as like some self-healing or awakening in that way, but definitely the universe was helping guide me.
I suspect the universe does guide us. And there are those incredible stories. People have had these horrible things happen, an illness, an accident, whatever. I'm so glad that I didn't have to go through that myself
Yeah, me too.
to find my way here, right? I had these more gentle nudges like you, and it took me a long time to decide to do it. I mean, I think we all have our paths, and at the same time, whether it's, a baseball bat upside the head, whoa, now I've got your attention, or this other thing that kind of gestates over time, there are these things that they kind of show up. And if we're paying attention, right? You listen to the right James Taylor song at the right moment and you go, yes, I'm going to go look at this. It's funny, these small little things. It's like these little course corrections, right? It could have gone here or it could have gone there, but you chose the one that took you to North Carolina. And then
I like nudges. They're much better than the baseball bat.
I prefer the nudges too. I get the bat on occasion.
Mm-hmm.
That just means pay more attention, dude.
Yeah. Sometimes it's necessary. We get stuck in that tunnel vision sometimes.
Yeah. So you've got this background in body work.
Yes.
That underlies your work with acupuncture.
Mm-hmm. So I've been doing body work for 20 years and acupuncture for 19 years. Actually, maybe it's 21 and 18. It's, you get it. It's just like anything when you go to school, one door opens another. And so when I was in massage school, I got, you get exposed to a lot of different types and styles of body work. And so for me, I become kind of addicted to learning things. And so, I love taking classes. So I did a lot of different stuff after that with like neuromuscular therapy, structural integration, cranial sacral, and just kind of getting involved with everything to really understand the body's dynamics and how, all of those work. I never really believed that there's one right therapy for everybody, so trying to understand, like, how do you understand the body and decide what tool you need, which is the right tool at that moment. So I always get a little nervous when you go to a practitioner and that specific style or technique or whatever is the holy grail that can fix everything. It's kind of some red flags. I think that the body has a lot of dynamics to it, and sometimes it's multiple tools together. Yeah, so I did an immersion into that world. Also studied postural alignment therapy and became a postural alignment specialist. Just kind of continued with that path with adding more movement therapy. And then I did personal training certification courses to kind of see, like, from that mindset, how does that integrate? Because I'm a big believer in passive and active therapies. I believe you really need the active component too. So I like to really merge those together.
When you say passive and active therapies, what does that mean?
So passive in the sense that, when you're having somebody manipulate you, whether you're having a chiropractic adjustment or whether you're having a massage, that's more of a passive style of therapy versus, if you're going to a physical therapist and they're giving you exercises, that's certainly more of an active. Now, you can still play an active role in your passive therapies, of course, right? If an acupuncturist tells you to take your herbs, you're still active, but not to the component of engaging your bodies and going through that whole neurological process versus somebody just doing something to you. I believe especially on a musculoskeletal level, you need that input. It's like with Chinese herbs, that's a take home that gives them the regular input they need to help get you to the next level a little quicker. People aren't doing acupuncture every day, in the West. So when we're working with musculoskeletal issues, what's that take home? Right? What is that input that can help get them to the next level? And also looking for long-term corrections and stability.
You mentioned the postural alignment.
Mm-hmm.
piece of it. And this is one of those things that for me has kind of been in the background. Earlier in the conversation, we were talking about the things that kind of catch your attention, move you in a direction, right? But maybe you don't even know you're being moved in a direction. I've heard a lot of stuff around postural alignment. I seem to read people in my spare time that talk about like how the body functions and body mechanics and how things are sort of stacked on one another or not, and the kinds of problems that can create or the kinds of healing that can come out of just putting things in the right place, right? Chinese medicine, I think, talks about this too. You take out blockages and things just flow better. You pull the kinks out of the hose, the whole thing works a lot better. I find that I'm often reading about people that talk about posture or postural exercises or just ways of moving in a more mindful way so that you know that your head is actually over your shoulders and not over like your toes or something. I'm wondering how all that fits into your work these days.
It's an integral part, for sure. I look at people's posture almost every visit. Obviously, that depends if where they're at in their series of or sessions with me. But the philosophy is position versus condition. You can have all kinds of knee conditions. For instance, we can talk about runner's knee, and we can talk about IT band syndrome, and we can talk about all these things. But I think what happens is we get stuck in that kind of tunnel vision on what the diagnosis is and how do you treat runner's knee or how do you treat IT band syndrome. But it's the position that causes all of those conditions. So I think we need to really shift and start thinking about the position of things and how does that kinetic chain work. And if we get things moving and we get things back in the place where they're supposed to articulate and how they're supposed to move in the right way, then the conditions clear up. When we start talking, especially Western medicine diagnosis, like bursitis, right? Let's say bursitis of the hip. We're like, oh, I got a great treatment for bursitis. I'm going to do, 3-inch needles and I'm going to circle, the greater trochanter and I'm going to get down in there and I'm going to run microcurrent through it, which is awesome. But if that femur is stuck in like external rotation and somebody's going through hip flexion and extension, even just walking on a daily basis, then they're constantly going to be irritating that bursa. So unless we really correct the alignment of the femur, which could also be caused from the foot, looking at that kinetic chain, then really we're not really treating the whole or the root, as we would say in Chinese medicine too. So I would say that sometimes you have to put the fire out, right, first, which is fine. Sometimes the person just wants some relief. Like, let's give them some relief. Let's let them understand that acupuncture is an awesome tool and they're all in, right? But we need to also educate them from that time with the first visit to tell them that we're going to put the fire out today, right? We want to try to get the bullseye as much as possible, but we do need to understand and look at your body and understand where this is coming from, because ideally, wouldn't it be great if it just didn't come back? Wouldn't it be great if you were moving more efficiently, so forth? I think that we can all agree there's a few schools out there that really have a strong orthopedic or portion of a program that really dives deep into understanding dysfunctions and compensations with body mechanics and how to treat pain at that level. I think it's an important piece, especially as we are moving in and really need to continue to evolve Eastern medicine to Western medicine. This is an easy bridge, right? That should be an easy bridge. The musculoskeletal pain piece, with the opioid epidemic and with, all this stuff and the big hoopla with dry needling and things like that. It's a perfect time to like think about how we're communicating to patients, think about how we're communicating with patients who are seeing other practitioners, whether it's physical therapy, and trying just to really push to understand it, at that level to where, we're gaining more knowledge in all of these areas to really help evolve acupuncture and especially musculoskeletal disorders.
I That makes a lot of sense to me on a number of levels. I mean, first, as you're talking about, it makes a great bridge. There's also the whole dry needling hoopla out there, which yeah, I don't want to get into that at this moment because that's not what this is about. But it's part of the landscape that we're looking at, and there's a whole languaging component, and there's a whole. I keep coming back to, gosh, when there's something that I'm resisting or something that's causing me trouble, what is inside of this that I might learn something from that might be helpful, right? So there's that piece, and then the other thing that really comes up for me is we can often really put that fire out super well with acupuncture. right? Acupuncture is famous for treating pain. And so people will get a lot of relief, often very quickly. And then they're like super disappointed because 5 days later, well, I slept great for a couple nights and then my shoulders started waking me up. And, they get this feeling of, oh, good, I'm going to get better. And then, well, gosh, it's more than just one time, or gosh, I need to learn how to reposition my body, or, there's all this other stuff that you're talking about in terms of, well, maybe the shoulder hurts because there's a problem with the hip, and the problem with the hip is coming from the foot. Let's take care of that foot. Your shoulder is going to get better. And, I think anyone listening to this podcast, we kind of grok that idea. We cotton to that idea. Oh, yeah, problem can show up here, but it's actually coming from there. It's a great idea, but how we actually learn to see it, understand it, and work with it, I think is a whole other kettle of fish. For someone like myself that does not have a huge background in body work, like I said, I've been reading a lot about different kinds of postural alignment stuff because it's such a black hole for me. What are some things that acupuncturists can do to begin to see that stuff and to begin to work with it?
Well, first, I think that they have to be honest with you, to go to a little bit of a foundation of taking the time to see it or taking the time to look at it. What I'm finding as I'm teaching my courses, some of the challenging pieces of it is that, it doesn't feel like there's enough time to do some of these things. And so I try to just let everybody know when you're in acupuncture school, you're doing pulse diagnosis and you're doing tongue diagnosis and you're palpating and you're doing all these things. So it's just incorporating a different set of tools. So first of all, knowing that you can do it and you can find the time to do it. It's just changing a little bit of a mindset and how you practice and what the flow is when a patient comes into your room and what the next steps are. So, instead of doing pulse diagnosis, you're going to be doing a postural analysis. So take that time to do that. Some of the first basic things to look at are the load joints on how they're stacked. So you have 4 load joints or 8 load joints, 4 on each side, ankle, knee, hip, shoulder. So even just being able to take a step back from the body, I always have people march in place and kind of help them reset. And I tell them to stop when they're ready and then look, forward at the horizon line. Don't move. I'm going to be looking at your feet. Don't pick your feet up. So coaching the person on how to make this more efficient. And so taking a general snapshot on, are those load joints stacked? It's no different than your house, right? You want a good foundation. You want walls straight. You don't want crooked walls. You don't want, so what do you see? What happens? And then from that front view, when you're looking at that, are the shoulders level? Put your hands touch the person's top of their hips. Are they level? Looking at the ASIS on each side, is there a rotation there? Looking to see if the knees are pointing straight. If the center of the patella, I always like to say there's a laser beam shooting out of it. Does it shoot in? Does it shoot out? Looking at the foot position, does it pronate in, for instance? And then if you don't know sometimes, so let's say somebody has a bound up SI joint and low back pain on the left side, for instance, and they happen to have a pronation on that left foot. And you're like, okay, well, they have this back pain and there's this little rotation in their pelvis and they're pronated on that left foot. For some people, that's a lot right there, right? But if you don't know what to do with that, go over, put their foot in the right position. Does that correct that rotation in the pelvis? So if you lift that arch up, for instance, and this is just, an example, if you lift that arch up and you see that all of those other things are correct now, well, then that's something you need to address, right? That's something that if you can fix one thing, it trickles down and fixes 4 other things, then that's more of a dysfunction. When you do acupuncture, and you're treating the right thing, you should see a result instantly. So if you're doing pulse diagnosis, for instance, and you hit the right points, you should feel a change in the pulse. So when we're doing acupuncture for musculoskeletal, and again, even if it's a corrective exercise you're giving them to, you should be able to see that change instantly. And so, and then from a simple side view perspective, is their knee over their external malleolus? Is their hip over their knee? Is their shoulder over their hip? Is their ear over their shoulder? Like that vertical load. A lot of times people have low back pain and they tend to push those hips forward. And so what happens is if they push their hips forward, it's like they're going to fall on their face, right? So they naturally, I always tell people, you have a gyroscope inside your head, just like your iPhone, right? If you turn your phone one way, it's going to turn too. So our head does that same thing. So you push your hips forward, your head's going to go forward. So it wants to correct, pull you back, and then you're compressing your low back. So you can treat somebody for back pain, but even if you don't fix that simple vertical load issue, they're compressing their back all day long. So sometimes it's really easy to see, and then sometimes you're like have to bang your head against the wall.
But when it's obvious, I suspect it's really obvious.
Yeah, and I think it's just training your eyes, just like, and the great thing is training your eyes to see posture and training your hands to palpate and to differentiate postural deviations is much easier than pulse diagnosis. Much, much easier than pulse diagnosis.
And why is that?
Well, first of all, in acupuncture school, typically when people are trained to see the body and palpate the body, and we have a room full of students, usually everybody sees the same thing, right? It's a bigger, more objective thing to, you can see it. With pulse, it's a very tactile, thing, and it's very subjective as well to that person. So in school, I don't know how many times, somebody's checking a pulse and the next person checks it and they're like, I don't feel that. And then the teacher comes in and, so everybody kind of has a different interpretation of it where it's a little bit more black and white. It's like either the shoulder's high or it's not high. Now there's little tricks because if there's a rotation, it can appear to be high. But once you take that rotation out, it's actually not high. It's just lower because of the rotation or higher because of the rotation.
So you're really learning to see where the problem is.
Mm-hmm.
I mean, you can really, if you know how to look, if you learn how to train your eyes to this, you'll be able to see where the problem is. It'll show up in the physiology, won't it?
Absolutely. And again, that even trickles down to once you start to understand and see the body in that way, you become kind of your own x-ray. Like if I sent you to get x-rays, you can almost kind of write down and interpret most likely what those x-rays are going to come back and look like. Oh, L2 is going to be rotated probably this way. You're going to have a little bit more of a bulge between here and here. You can start to drill that down. It's a fantastic tool, and I think that it creates a common language. It is a new language when you start talking about anterior pelvic tilts and torsions and, tibial torsion and things like that. And it can feel a little bit overwhelming, but compared to learning pinyin, it's much easier.
Then learning what?
Pinyin for Chinese herbs. And
Oh,
stuff.
pinyin. Oh,
Pinyin.
God. Yeah. Well,
So.
This episode is brought to you by Jane, the clinic management software that honestly just makes running a practice easier. Let's dive into something that's never easy, but sometimes necessary: raising your fees. It can feel awkward, right? But here's a tip that can really help. Consider offering flexibility to your patients as you introduce the change. When patients face new fees, it's natural for them to feel uncertain or concerned. That's where flexibility can really make a difference. Offering options like a phased increase, suggesting a payment plan, or even taking a moment to talk things through can help to ease the transition. These thoughtful gestures show your patients that you're listening and care about them, which strengthens the trust you've worked so hard to build. If you're looking for more ideas on how to navigate these kinds of changes, head to frontdesk.jane.app and check out the article, How to Tell Clients You're Raising Your Fees. One last thing, if you're ready to give Jane a try, you can use the code CHIOLOGICAL for a 1-month grace period on your new Jane account. No kidding. So for someone like myself, and maybe some of the listeners, if I wanted to go and get these basics, learn how to train my eyes to see this kind of stuff, where would I go? I mean, it's one thing to look at a book, but it's another thing, I think, to be in person, have people pointing things out, show you, oh, look, this is connected to that. And where would I go to do some of this?
Obviously, I'm going to be selfish, and my course I teach at downeedle.com, the level 1 course is amazing.
So you teach this stuff?
Yeah. So in my level 1 Dao Needle therapy course, we go over postural charting on how I have a specific way of recording posture. We have postural analysis, and we work with each other and identifying those and what those things mean. Just like in Chinese medicine or Western medicine, even for that fact, we want like 3 things pointing us to the right direction, right? I hear what you're telling me. I feel what I feel that's also pointing me to the direction of the problem, and I see it, or whatever those diagnostics are. And so we want to see it, but then we also, and I want to hear what you're saying, but then we also want to prove that too. So we do incorporate what I call functional tests. So you tell me you have back pain, you tell me it's been going on for however amount of time. I'm going to look at your posture and see, like, okay, I can see clearly why you have back pain. And here's where I see more of the dysfunction is. And now I want to prove that theory. And so then we teach the functional tests, which those functional tests then become corrective exercises. So if you are positive, which means you failed a certain test, that's like, okay, so I had a posterior pelvic tilt and I have low back pain, and you feel the person's spine and there's no curve in it because of the posterior pelvic tilt. Then I'm going to do a test, let's say static wall femur rotations, which is just checking the length of that posterior chain, which I don't want to go too far here, but we get into a lot of
No,
fascia.
that's okay. I hear you use the word posterior chain. I almost understand what that means, but I
Good.
actually don't quite understand what it means. So what are we talking about here?
Yeah, so not to deviate too far. So especially from the
We
world.
can go as far as we want.
All
This is
right,
the fun thing
perfect.
about the podcast. I get curious about this stuff. I'm hoping I can learn a thing or two so, I can be helpful to my patients. I see people do this all the time. They come in, they got a certain problem. We're talking back pain. Let's say the back pain. They've got a story about their back pain.
Oh yeah.
Everyone has a story about whatever diagnosis or symptom they've got. And sometimes their story is right and we should pay attention to it. But a lot of times their story it's just a story and it's a red herring. And if we believe them, we're not going to be able to help them
Yep. Totally agree.
because they are living in their body, but they got no idea what's actually causing the problem that they've got. What I'm hearing you talk about is that there are some very objective ways that we can learn to look at, see, and interact with the body so we can be clear about what's going on and really be able to help our patients. So tell me about posterior chains.
So in posterior chain, you typically hear more, that's more of a terminology in the fitness world, right? Personal training and stuff, talking, and even physical therapy to some degree. But that posterior chain, we can also talk about from a more of a fascial perspective, which is also musculature connections as well. It's not just all fascia. From more of an anatomy, from like Tom Myers, is a great one who does a lot of the fascial dissections and stuff. And so that posterior chain, in those terms, also called the superficial back line. So it connects the plantar fascia to the gastroc, to the hamstrings deep to the sacral tuberous ligaments to the paraspinals to the suboccipitals, occipitals all the way up to the frontalis. So basically, it's the urinary bladder channel, right? So Tom Myers is a great one who does amazing dissections and things like that. From a Western physical, again, PT world, fitness world, like it's always been called that. Just like in Chinese medicine, we know it all connects, right? So
Right.
it's
Is
just,
he the guy who wrote Anatomy Trains?
yep, he wrote Anatomy Trains. Now,
Okay.
I just did a class in Canada and met an amazing individual. His name's Pony Chang. And
Oh, yeah. Pony's work is amazing.
yeah, Pony's awesome. So the great thing is Pony's doing what Tom Myers is doing as far as the fascial dissections, but he's also crossing them over and taking a look at them as well from the Ling Shu and some of the classics and doing those connections. So when his book comes out, everybody should definitely check that out. Tom Myers is a great book. And again, a lot of them, whether it's the meridian or whether it's the chain, which I like the word chain better than like the fascial line. I'm probably gonna start changing that because you say line, it just doesn't have a certain life to it. You say chain, it's like, oh, okay, this can affect this moves here. But when you say line, it's too static, and just like Assure points. In the course, we go over mapping and kind of grading Assure points. And because Assure points talk to you in a different language too. They're not just like it's a tender point, right? The amount of tenderness and the amount of pressure for the mechanical threshold tells you a lot different things versus one tender point versus another. Getting back to in the class, when we're looking at posture, we want to prove that. So we were using the scenario here of somebody with a posterior pelvic tilt. So this is a common thing. So somebody has a low back pain, posterior pelvic tilt, right? Maybe their knees are slightly bent. Okay, when you're looking at their posture, and so I start to go, okay, well, this superficial back line, right? And we'll break it up into superior and inferior. So inferior below the pelvis, superior above. And so I might decide, well, I think what's happening is their hamstrings that and their calves are somewhere in that inferior part of that posterior chain or superficial back line is really restricted, which is causing that pelvis to be pulled back because of the attachments to the ischial tuberosity, pulling the curve out of the spine, causing pain, causing compression because it's taken out the natural curve. So then what you would do then is test that. So we use a common test called static wall femur rotation. So in this scenario, the butt needs to touch the wall, butt touching the floor, legs up the wall, knees locked out, feet flex back. And the most important part in this case is the feet flex back and the knees locked out. If their butt's way up off the floor, they have to scoot back, to keep those feet flexed back and the knees locked out. And the further back they have to scoot, the more that positive it is. So a functional test that tests, that they're perfect and it's not impeding on pulling that pelvis back should be that their butt's touching the wall, legs up the wall, feet flexed back, knees locked out. So that perfect 90 degrees with tension on that line. Let's say you have to scoot back 3 feet to keep your knees locked out and your feet flexed back. That tells me, without a doubt, we have a problem in that line that's causing that pelvis to be posterior, that's causing that curve in the low back to be pulled out, that's causing that spring that your spine should be to be dysfunctional, right? So I'm going to treat your low back directly. I always, Dr. Ton's awesome. I like his saying that, if it hurts, why stick a needle in it? It already hurts.
Yeah,
So
right. Don't spank a crying baby.
yeah, exactly. I come at it from a different approach where I believe if it hurts, I want to break that muscle energy crisis. I want to get new blood flow to the area. I want to get that chi and blood stagnation really moving. I want to break up those restricted fascial fibers. I want to break up, those restricted muscle fibers that's causing a decrease in oxygen and causing that muscle energy crisis. I'm going to really treat it specifically right there, put that fire out. But I do want to make sure, and maybe it's not the first visit, but I do want to make sure I come back and start treating that inferior aspect of that posterior chain, really understanding, you could find out that, hey, they had severe sprained ankles when they were playing basketball, or whatever. And so that sets up a really big imbalance in the calves and the Achilles and stuff like that. And it could all be coming from there. You free those up, you free those Achilles up, you free those gastrocs up, and it can free everything else up above as well.
Yeah.
So
So you really see those local Ashur points as being a deep kind of chi and blood stagnation.
mhm.
And sometimes you just got to break the dam.
Yep. Sometimes you got to break the dam.
And
Yep.
that can be super helpful in getting the fire out, so to speak. And then it lets you work on what's downstream. How did that get there in the first place?
Yep. Exactly. And the Ashur points, the great thing, if you take the time to understand them in a different way, they become a roadmap for you, a roadmap and also a therapeutic gauge on how the person is responding and how they're healing. So if you don't know, if you don't know what's going on at the end of the day, you follow those Ashur points. But again, you have to understand them a little different. Which one's more dysfunctional, right? Which one, and how do you understand that? So, that's something that we go over, and that's something that I live by in my practice, because at the end of the day, the patient's body is going to tell you, right? So if you can't see it with your eyes and you're like, I think it's something starting down in here, then that's when you get into, palpating. And so, there is an art to that, to understanding those Ashur points, but there's also, some skills that need to be developed with palpation and feeling motion palpation, and right what a fascial restriction feels like. And, the difference between, super hypertone fibers within a certain muscle grouping. So there's some art to it, but it's much easier than pulse diagnosis.
Well, just having the idea that all Ashur points are not the same, I think is helpful. I mean, in the past, up until having this conversation with you, sometimes I'll palpate, I'll feel some points, and it's like, oh yeah, really, really bound up there, really gummy. Actually, I do have a little more nuance in that now that I think about it. Because sometimes it's like, oh, yeah, it's like there's a little gummy in there. And other times it's like, oh, there's a pebble in there. And there's other times it's just kind of gooey. I guess I do have a vocabulary for usher points now that we're having
You're
a
doing
conversation.
fantastic.
Well, I just
I'm gonna start incorporating GUI in my work, in my material.
well, I've found with pulses over the years, there's all the pulses that we learn in school and that we have to regurgitate for the test. And then there's moments where I'm working with people and I'll put my hand on their pulse and I'm like, "What the hell is that?" Because it's not like a pulse that I've felt before. Or actually, there are certain pulses, I will feel them again and again, but it's nothing that I learned in school.
Mhm.
I've learned over time, I don't know if I've learned, but I've acquired the habit of naming certain pulses in certain ways because I've found them before. It's like there's that ringing pulse again. And now it's my job to go figure out what does that mean and how do I treat it? And can I make it go away? Can I make a change?
Perfect.
Right? I mean, coming up with the name is that's not the treatment. That's just like noticing, oh, this is something that I actually don't know much about because I don't have a usual word or way of working with it yet.
I think it's beautiful though that you do that because it helps you connect to what that pulse feels like, so you remember it. It's like putting the flag, on the moon. You've been there before, especially obviously with the classics. The way we learn pulses, it's like it's hard to connect with a knife scraping over bamboo feel, because you just don't do
No,
that. So I think it's
because I don't cut bamboo. My wife does
it.
that.
She cuts the bamboo.
She cuts the bamboo.
You have a bamboo garden.
No, but she gets fresh bamboo from local Chinese farmers and we have it for dinner.
Oh, great.
Yeah.
Yeah, you look pretty healthy.
My wife's a great cook.
Good.
Yeah, so being able to name things, with our own name, so to speak,
Hmm.
it gives it a kind of a reality. I'm super glad we're having this conversation because I'm looking forward to the next time I'm in clinic and poking around with these sure points and seeing if I can get them to talk to me in a different way.
For instance, if you palpate it and you hit a spot and a person has a response or a startle response, that means that spot most likely has a lower mechanical threshold, right? The lower the mechanical threshold, the longer it's been there. So compared to the spot that you hit and you're like, holy shit, and they jump off the table versus oh, that's pretty tender. That actually, it'd feel great if you massage that. So that compared to the other one, that one's probably going to become what I call X versus O. So an X we always mark is a really, really sensitive spot, lower mechanical threshold, diffuse specificity versus I just want you to massage that a little bit. That's tender, but there's something there. That one eventually will become more tender if untreated, right? So it's almost like there's these little, those sensors are giving birth to other little sensors. Like if somebody has a shoulder pain and they don't treat it, there's going to be some hot spots there for sure. Maybe it's in the trap, whatever. But eventually, all of a sudden, you fast forward and it's creeping down the arm, it's creeping up the neck. And then next thing you know, they haven't treated it. It's a couple of years later. And then they're the person that in every conversation likes to talk about their shoulder problem. Hey, have you been, Michael? Oh, man, my golf game just hasn't been there because of the shoulder problem. Everything becomes that. So if you can catch and understand the difference between those, again, they become your roadmap too. On even if you don't know the kinetic chain and how those lines follow, if you're just following those kind of X's and O's, so to speak, they'll at least take you a little further down the path.
So you kind of are making your own contour map, so to speak.
Yeah, exactly. Yeah.
Yeah.
So,
So let me make sure I got this right. The ones that are, oh, that's tender. Yeah, massage that. That feels good. That's a newer one or an older one?
that's a newer one.
That's a
Yeah.
newer one. And
The
the
ones
ones where
that
you
are,
press it and their eyeballs pop out,
yeah.
that's the one that's been there a while.
Exactly. So that's going to be chicken versus egg. Like, where'd we start? So, you always want to get those first. And most likely, a lot of those are going to be the ones that you have probably felt before. They're probably going to be the ones that you've pushed on and they're really, ropey or hypertone. So, but to get the person's feedback and to see the difference later after you've done some treatments, is fantastic because again, it's a therapeutic meter. All of a sudden you're pushing on those spots and they're not hot anymore. And let's say they're saying their shoulder's 70% better. Great. It's time to find the other area that you're not working on, that you should be working on, right? So you've gotten this cleaned up. For instance, with a shoulder, you have back arm lines and you have front arm lines, and there's a deep one and there's a superficial one. So it's common that you have both anterior and posterior sides involved. And so you've been working the posterior side and things are, they're at a certain place. Well, now it's time to check what's going on up front and see, which one of those lines are involved because and again, this goes back dysfunction versus compensations. I'm just going to throw this one out here because this is a common one you see. Somebody has a shoulder issue, their AC joints compressed, all this stuff. But what happens is they're kyphotic and the shoulder blade has to fall out to the side. It has to be pushed out to the side, right? The shoulder is going to roll forward, going to compress that joint. Then when you go into abduction or, even extension and abduction combo, whatever, it's going to compress that joint. And then that's one day their shoulder's fine. Next thing you know, they go to get the can of chicken soup out of the counter and they tear their supraspinatus, right? So we're whacking away on their shoulder, but we never treat the kyphosis. The shoulder is always in the same crappy position, never gets resolved because we never worked on that kyphosis. So again,
you got to put it back where it belongs.
Yeah, you got to put it back where it belongs. So again, that's just an example of we put the fire out, but how do you set this person up for long-term success, right? So and in that case, that situation, there's going to be both lines involved, from the posterior and anterior aspect of the arm and the shoulder. What's going to happen, though, is one's going to be working hard and one's going to be really restricted and tight. And the other one's going to be tight and short because it's gone through more of an adaptive shortening phase. You take point A, point B, bring them close together, they're going to be tight and short. Even understanding the difference of those, becomes really important for long-term success.
Yeah. It's so interesting too for me how you talk about dysfunction versus compensation. And our bodies are so incredibly malleable and adaptable. There are all kinds of compensations that we will do over time. It keeps us going. Often it can keep us going a long time, but it's also taking us down a path that at some point, end of the road, pal.
Yeah.
Right. And so to be able to differentiate compensation from dysfunction and how to recognize, oh, someone's actually taking themselves off the rails in slow motion. How can I stop this? I mean, this is one of the great things about Chinese medicine is, supposedly the best Chinese doctors sweep away the problems before they arrive.
Yep. That's beautiful. That speaks to this scenario that everybody has happen on a regular basis, that a person comes into your clinic and the first thing you hear is, oh, my neck is killing me, or name your own body part. I don't know what happened. I just woke up. This has never happened before. But really, it's been brewing for a long period of time. Those compensations have been compounding. And, hey, the only compound we want is in our bank account, right? In our 401k.
Yes.
Outside of that, normally, it's not always awesome. So there's a compounding effect that takes place. And the difference between pain and no pain can be a 16th of an inch. But they've been dysfunctional and compensating for a long period of time. So when you're talking about sweeping away the problems, I think first in that situation, letting the person know, I know you feel that way. I know you feel like this just happened because that's pretty common. That as I'm feeling your neck, it's moving like a giant metal rod, like it's been like this for a while. Again, we want to put the fire out, but we have to get mobility back in here, right? We have to get these restrictions and stuff, get this chi and blood. I don't really speak to my clients as much about chi and blood. I talk to them about stagnation stuff, but we got to get this
I'd like
moving.
to tell them I want to take the kink out of the hose. They get that one.
Yeah. So, connecting with whatever metaphors, but yeah, so sweeping those away. But that's a common thing I think that we see a lot is, I don't know what happened. I just woke up and this has never happened before. Here it is now. But usually those compounding compensation effects, don't play out very well.
No. And they end up in our, like you say, they end up in our office. I just reached down to pick something up off the floor. So, I could go on and on with this kind of thing because it's of interest to me and I feel like I need to learn so much more about it. But I'd like to shift just a little bit and talk about some of the treatment that you do. I mean, name of your therapy is, Dao needle, right? Dao needle. Not Dao like Dao De Jing, the Dao, the
Yeah,
path, but
yeah.
Dao like knife.
Yes,
Right.
exactly.
So
Yeah.
so cleverly you use the pinyin instead of the English word, because my suspicion is if you said, "Yeah, I've got some knife needle therapy," it might be harder to get patients into your clinic.
Yeah, and so I started with knife needle therapy because that's all I knew it as. You know, people like drama, so there were some patients that are like, "Oh my god, I went and told everybody I got knifed." So
So you get the
so
drama queens in. That's
yeah.
great.
So people that have had it done, they really like to tell their friends that they got knifed. So sometimes I still tell clients that are fun, playful clients that, the word "dow's" is the actually the word for knife, and so they can still have fun with it. But yeah, it's not a very marketable name, especially when people just even hear about acupuncture and they're like, "No way, needles getting stuck in me. That sounds horrible." So a knife being stuck in you, they usually send their spouse. Funny enough, right? You're gonna stick a knife in my spouse. So
Hey, you want to hear something funny? I just want to. This is a slight aside, and then we're going to get back to this. So I had a patient in one day who had some pain. I go, well, is it like a dull pain or a stabbing pain? And he says, well, stabbing pain doesn't really feel like anything. And I'm like, what? He goes, I got stabbed once, and it's just more like this warm, wet feeling at first.
wow.
So,
Wow. Well, if you've always wanted to know what that felt like, I think you had somebody speak to that honestly.
well, it's like when you get a paper cut at first, you're like, oh, I think that is going to hurt later.
Yeah. Yeah.
Yeah. Anyway, I digress. I, I'm curious to know how you came to doing this kind of work with needles or knives, or I mean, what are you actually using here, first of all?
It's called knife needle. So it's an acupuncture needle. It's just different. Instead of that cylinder, ballpoint pin kind of shape, if you will, that cone shape, it's got a beveled, chiseled edge to it.
Like some of those old needles that you see in
Yeah.
the displays of the 9 traditional needles.
Yeah, exactly. It's not quite as big as like a sword needle or something crazy. So it's a different style of needle, and I'll tell you why it's important. But the background of why and where I started using that needle is I had a friend of mine who was from South Korea, and she's an acupuncturist, and so she unfortunately had to have a mastectomy, so she had her right breast removed, and so she was having a lot of cording and fascial pain and stuff like that on that right side, and so she was doing acupuncture to herself on a regular basis, and then she was getting a lot of myofascial work and some deep tissue stuff, which typically is really good for that condition. But she was just having limited success. So it helped a little bit, but she was just really stubborn and becoming chronic. So her family still lives in South Korea. So she goes back for 3 months at a time. So she went to South Korea and she went to an acupuncturist. And the acupuncturist is like, oh, I don't know why I like to use my Asian language here, but we need to use knife needle on you. This person, it was kind of more feeling restrictions and needling it. So, in South Korea, they use it a lot for tendon stuff and breaking up scar tissue and adhesions. So basically, that's what she had done. But one treatment, she felt dramatically different. So she got more treatments, and then she ended up staying there and studying on how to use the needle and stuff with this person. And so, luckily she brought it back to the States and taught me, and we spent time doing it and understanding it. And I got to use it on her and playing with it. And then, I had some needles and I stuck them up on my shelf, and it became just kind of out of sight, out of mind. I was excited about it, but like this didn't know what to do with it yet.
Right.
And so I put it up on my shelf, and I had this patient
You
who
were
I've been
you were waiting for the right song to come along to inspire you.
I was waiting for that nudge. And so I had this patient come who I feel really terrible for even saying this, but I've been treating him at this point, it was like 15 years. But he's just been, a good patient. He started when I was just doing massage. And so I mainly did more body work kind of stuff on him. And then he was seeing my buddy, who's a chiropractor. So he was getting, chiropractic and all this done. He's a golfer. He golfs like 4 days a week. And he's like, I just want to talk to you about this. We've been doing some work for a long time, and I still have this horrible stabbing pain just to the medial, well, he didn't say medial border, but the medial border of his right scapula, level with about T3, T4, T5. And so he's like, do you think we'll ever fix that? And I'm honestly, in my mind, I'm like, I totally forgot about that. It was just one of those things, you get comfortable working with somebody. So it really put me in check. And so when he said that, I had my aha moment. Wait, I have these awesome needles, and he has this stubborn pain. And it seems like it's a perfect time to do that. So I'm like, hey, I have an idea. How would you feel if I used these knife needles on you? I went and I got those out, and he was totally game. And we did it. And sure enough, after it was probably 2 treatments, it was gone. So maybe 3 minutes, gone. So to this day, he still doesn't have it. So, again, it was like a right tool for the right situation. He had been using these other tools. And so that really opened my eyes up to possibilities. I'm fortunate to have a busy clinic. I founded my office in 2001, and we have a lot of different practitioners that work with me now in different therapies. So to me, it's my playground. And so I have awesome clients that I'm just like, hey, how, would you feel if I tried this on you and play? And so I started just diving deep into it and working with my clients and kind of testing the waters with certain things, and realize the effectiveness of just the power of using that needle with that different tip. But going back to our dysfunction compensations, there's kind of a hole with it, right? So they use it more, again, in South Korea for tendons and scar tissue and stuff. But when you start treating muscles and start treating pain and the whole kinetic chain, what happens is, if you're treating again somebody's shoulder, but you don't really correct that kyphosis, then you're really not getting a long-term correction. So you're breaking that chi and blood stagnation for sure, right? Without a doubt. And you're breaking up those adhesions locally, but then you have to go back and look at the missing pieces. That's when I started taking my background and really putting together a really nice, thorough system of adding more diagnosis and differentiation with the passive blend of passive and active therapies and stuff like that. And then, over a 6-year period, down needle therapy, has finally arrived as what it is. And so it's constantly evolving, and I'm constantly working on it. I'm learning some things the hard way about what's too much information, what's not enough, and stuff like that, and getting great feedback from people and students that are taking the courses. And so that's how it was born.
Having a thriving, profitable practice is one of the most healing things you can do as a healthcare practitioner, because a robust business is the ultimate expression of vital chi. And that's the heart of our medicine. I'm Julie Bairdontlock, and I help practitioners grow nourishing, profitable, authentic businesses that embody the generative cycle of Chinese medicine. This isn't about all yang all the time. It's about expanding your own internal capacity, growing collaborative relationships with your patients for ethical patient retention, and marketing as an extension of this medicine, not a necessary evil. You already know that everything is connected in your patients' lives and bodies. The same is true for your business. When we align your systems, your schedule, your pricing, and your offerings with you, we create flow, which means more spaciousness, more impact, and more joy. When you are in the flow, fully resourced in terms of chi, time, and money, your business becomes a source of healing, not just for your patients, but for you. Let's grow something rooted, radiant, and real. Visit lifeflowconsulting.com to learn more.
Wow. So using the knife needle, and I want to get a little more into that in just a second.
Mm-hmm.
It's a piece of what you're doing, along with really some pretty sophisticated diagnosis.
Yes. Yeah.
And the knife needle itself is used specifically to break up lots of stagnation. Would you necessarily use it at, I'm going to call it, the root aspect of what's going on with someone, or is sometimes that just something that you'd correct with some exercise or some postural realignment, or just having them do things in a different way, different habits?
Yeah, both those answers are correct. You want to use it for that root area for sure. But I always like to reinforce with those corrective exercises. And, they're very different treatments if it's, let's say, excess versus deficient. So if somebody
Uh-huh.
comes in
Yeah,
and
yeah,
they're
yeah.
excessively tight, right, or shortened in certain fibers, we're going to treat it a little differently. If somebody is weak in part of that chain, then the needle style changes and the corrective exercises change.
That,
Obviously,
that totally makes sense.
yeah.
So if I'm tracking this correctly, I would think that the knife needle, super helpful for excess. Maybe you wouldn't use it so much for deficiency.
Well, we use it, we just use it differently,
Mm-hmm.
That's a lot to get into, but we do treat differently as far as where we're treating and how we're treating and depth and stuff like that. But the great thing about the knife needle is we do have to. I've challenged this many times, and the fault that I when I first started that I really at the beginning of my class try to get people to understand is I want you to be really open minded to who and what person this would be applicable to. Because for me, like I used to think back in the day, all right, this 82-year-old lady clearly isn't going to be able to handle this style of acupuncture, right? And I was completely wrong.
Uh-huh. Tell us about
Completely.
that.
Well, so I have, and I'll just use this person as an example. I have this nice 82-year-old lady. So at the time, she was probably like, I don't know, 78 when I did this with her. But she had a really pretty severe scoliosis and she had shoulder pain and back pain and, pain everywhere. And so, I was giving her some corrective exercises and she was really good about doing them and we were seeing changes. But I decided one day, I'm like, let's try. I mean, you have so much restriction in some of these areas. Let's try. And to be honest, she hates regular acupuncture. So this wasn't easy to talk her into at first. I mean, to put a regular needle in her is usually pretty uncomfortable for her. So I talked her into it and she did way better with it than she did with the regular acupuncture. She loved it and she had no problem with it. So, I was assuming what somebody could or couldn't tolerate. So this goes back to patient communication is huge. And this I could have a class just on patient communication. I own a couple other businesses where we have a lot of massage therapists. So between all of the businesses I have, we have over 100 about 100 massage therapists, and a lot of issues we have comes down to patient communication, right? So I have to spend a lot of time in this area of coaching and talking about this. But when we're working with patients, first of all, don't assume what they can or can't do. You need to empower them and let them know, hey, here's what I want to try, here's why. But at any time, you're the boss. We have lots of tools in our toolbox. And if something's not a good fit, you make sure you tell me. We can change it at any time, right? So that's what I started doing and stopped assuming who was a good fit, whether it's a body type or, like, for instance, I had a person that had fibromyalgia and they were obese. And really, if you go to put a little pressure, just a little pressure with palpating, they jump off the table. So I didn't, again, I was like, down needle, I don't think they're going to be able to really do that. And I stopped assuming one day and I tried it and they responded beautifully, much easier than manual manipulation. So patient communication and empowering the patient that they're always in control. It doesn't matter if you're doing regular acupuncture or cupping or gua sha or Dao needle or whatever. They should always be empowered to know that, hey, we're developing a relationship. We're going to figure out the right tool. Dao needle specifically is its bread and butter is acute pain, chronic pain, and scar tissue. So I'm not using it really to treat insomnia. So it's I'm using it for musculoskeletal stuff.
Right tool for the right job.
Right tool for the right job, baby.
Right tool for the right job. I had a shop class when I was in the 8th grade, which was really fun because we got to make stuff. But the main thing I remember from that shop class, this teacher would always say, "Right tool for the right job, boys." Stuck with me all these years. And it's poignant for me at this moment, having this conversation with you, hearing about using what many people would call an aggressive kind of technique, right? Or something that's going to have a lot of chi to it, or really be breaking some stuff up. And yet, if it's the right thing at the right moment for that person, even if they look weak, because they've got this area where they've got all this stagnation, you get in there and bust up the stagnation, they're going to say thank you. The experience for them is going to be, I feel so much better, right? If you do the right thing at the right time, it might be, I'm using air quotes here, an aggressive treatment, but because it's exactly what they need, they're going to respond well. That makes a lot of sense.
And it's one of those things too. It feels like a lot of people just feel like they've had a release that they haven't been able to get. Or I always like to say it's like an itch that finally got scratched that just never felt like it was ever really scratched. Another thing too, when it comes back to aggressive, if you will, or that, it's really, again, like for instance, you came up with that. I never said it was aggressive, right? So
Right.
that was
That's
something you came up with based off of what your mind's perceiving it as. And so this is again an example of a mindset. Like, you don't know until you try. But what I have found is, and again, we're not need to get in dry needle world, but all of my patients that have come in that have had dry needling done, this hurts way less than that. And so if that amount of people are going out, which there's a lot, and getting that therapy done, there's plenty of room for Dao needle therapy and treatments. And the other thing is, usually, to be honest, what hurts the most is you're palpating. When you're pushing on those spots and finding those tender spots, usually that's more tender than doing the needling.
hmm Well, I really appreciate you pointing out mindset for me because yes, my mind was going, "Oh, aggressive. That's aggressive." And really what it is, it's appropriate. I've got the idea, oh, big needle, maybe a lot of stimulation that equals aggressive. Well, if that is what is actually being called for and that's what's appropriate, then it's not aggressive. It's just what's called for.
Yep. And the needle, when you're doing the insertion, the needle actually goes in and right back out really fast. So there's not a lot of, at least there is a time where I use it where there is a little bit more, but that's at a different level. But for the most part, you're going into those Usher points, into those restrictions, into that scar tissue. You're coming right back out really fast. And once you develop the technique of utilizing it and your speed and your rhythm and your depth, then it becomes pretty effortless. It becomes pretty comfortable for the person. It's an amazing tool that has an amazing place that needs to exist in everybody's practice when they're treating musculoskeletal stuff. And the reason I wanted to dive into this for a second is I'm a gadget guy. I own lasers and cryotherapy chambers and hyperbaric chambers and shockwave therapy machines and magnetic resonant mats and like all that stuff. But I like to play with all them and prove like their effectiveness. So I think someday when I have time, I'm just going to have like a blog on just me playing with toys or, proving them with, whatever tools I use, thermal imaging or, all that jazz. But so I have a force gauge or a pressure gauge. And basically what that is it picks up the peak pounds of pressure that I use when somebody has that illicit jump response or when they say it's really tender. And so I've played a lot with Sure points and measuring those mechanical thresholds and utilizing a lot of different tools. And so I've used different gauges of acupuncture needles and I've did different manipulations, some from Jerry Gentle, some to more aggressive, and measured, and none of them compared to changing that mechanical threshold compared to the Dow needle. And even smaller gauges or bigger gauges, I guess, of Dow needles, the difference, like the one we use is kind of a sweet spot. So I tried to use a gauge that is a little bit more fine, but even it doesn't elicit the same change, right? And so then I've done lasers on Assure points and I've used different massagers on Assure points and I've done, some Graston or gua sha or whatever you want to call it on Assure points. And I've used shockwave therapy on Assure points. And again, just that needle and that particular tip to that needle and stuff has the most dramatic effect on the change of that mechanical threshold into that tissue. And a lot of that goes into the science of needling. If I'm doing manual manipulation on somebody where we're using a shock wave or laser, we're not actually putting a lesion into the tissue. And the bigger that lesion is, again, you don't want to go too big, but the bigger that lesion is, I think it just has a much more dramatic effect for telling your body, hey, let's restart the process here. We got to pay attention. Let's start sending some repair cells down here, send in some new blood flow to this area. It's got kind of, I always say your body gets stuck in stupid sometimes, right? And so we're trying to break stupid. And sometimes to break stupid, you have to talk a little louder to it, right? And so, and therefore that lesion then lasts longer. Now, I don't have any science behind this, but I like to use the example that if I put a regular acupuncture needle in, maybe the body's still doing work for 24 hours, right? And when I put a Dow needle in, the body's doing work for 72 hours, right? So it's like, hey, we're going to continue to give this attention. Send some the inflammatory soup stuff down here and really like start getting some good repairs. And it's like a reset button. So the tissue has hope. Your tissue has hope.
Yeah, I like that. Maybe because I live in Missouri and you're from Missouri, that thing about stupid. We always talk about stupid here. You can't cure stupid.
Yeah.
We get into these homeostatic balances. Homeostasis doesn't mean health necessarily. It just means that the body knows how to keep itself where it is, in a way that lets it kind of get stuff done. And being able to reset the homeostatic balance, I think, is really important and really, really helpful, and often very difficult, because even though the body has found a balance that lets it get stuff done, it may not be optimal. Which we talked about earlier, will take us down the road that, a few weeks, months, years. Oh, now the conversation always includes the shoulder,
Yep,
right?
exactly.
Because
Yep.
we haven't been able to change that balance. So it sounds like you have been experimenting with lots of different ways. You're kind of a mad scientist, it sounds like.
That's so much fun.
Yeah. And found some ways of helping to really reset things in a pretty profound way.
I think we all need to be a little bit of mad scientists in our practice though, right?
Works for me.
Yeah. I mean,
Yeah.
that's when you're all in, you're all in, and I think that, it should be fun, and it should be, something you play with and continue to, hey, if somebody hasn't tried it, it doesn't mean it's not something that could be applicable or work in a good way, so give it a
Yeah.
try.
Just means I don't know about it yet. Give it a
Yeah,
whirl.
exactly. Yep.
Where would people find out more about what you're doing?
DaoNeedle.com. So DAOneedle.com is the website. I am doing some fun changes to it right now. So there's some parts that are under construction. We are, or I am, I guess I should say, playing around with. I'm launching a foundations course this year. So one of the things, just to be my own critic here, with the course is it's a lot of information. So my level 1 course is 2 days. All of the feedback I get, the biggest thing is it needs to be longer. And so I'm trying to find that balance of not too much information, but not also sacrificing my beliefs in where we need to go, because I really do believe in long-term correction and this marriage of passive active and adding all these things in. So I'm having my first actual foundations course coming up in a couple weeks, where I'm just doing kind of a 1-day immersion in it. And then later this year, I'm going to have a foundations course in Santa Cruz. And the difference with the foundations versus the level 1, the level 1, you're getting all the postural analysis, you're getting all the functional tests, you're getting that skill set.
That
But
we talked about earlier is so essential in being able to actually see what's happening for people.
Exactly.
Mhm.
So the foundations course is going to be different. What I find is people, again, I'm going to try to lay a different groundwork where I'm doing more protocols and not going over some of that stuff. So I'm going to be doing a lot of different treatments for, the knees and hips and all that good stuff. So you're going to have a really deep experience and rich experience on how to utilize the needle and really getting the finesse and the depth and the angle and the mapping and grading of Ashura points and stuff like that. And then I'm going to see how that then blends into the level 1, because I think that the level 1 is so much information that when you go to work on Monday morning, your head's spinning with all this information. And I just want to make it as user-friendly as possible.
Right. So let me make sure I understand. So
Yeah.
the which is the one that gives you the diagnostics, really being able to see where things are?
Yep, the level 1 course.
That's the
So,
level 1. Okay.
yep, the
All
level
right.
1. Yep, the level 1 course. And it doesn't you can take either one in any order at this point. So if you want to take the level 1, you're still getting your hands. It's all very hands-on. It's like 2 hours of lecture time, and it's super high-paced and super fun. So we just have a good time. So the level 1 course is going to be really rich with all that information.
Well, thank you. I have so enjoyed our conversation today, and it's given me a ton of new things to think about, along with this sort of, back of my mind inquiry into posture and alignment and, just stuff that's been like nagging at the back of my head. I've now got, I got some new things to think about and try out. So I really appreciate it.
No, I appreciate you. I appreciate you having an interest and taking the time to chat today. So I really enjoyed myself, Michael. Thank you.
You're welcome. All right. Well, you have to go to a baseball game, right?
That's right.
All right. Well, thanks for being on the show today.
Thank you, Michael. Have a great day.
Well, here we are at the end of this episode. If you've listened up to this point, you're either a rabid fan of Qiological or the forward button on your podcast player stopped working. If you are indeed a fan of the podcast, you can help us to bring new episodes to our community of practitioners by supporting us with a membership or a one-time contribution. Details, of course, are on the website. That's it for today, friends. Join us again next Tuesday for another thoughtful episode of Qiological.